Welcome to the meeting of the Muskogee Municipal Authority for July 13, 2020. Roll call.
Mayor Marlin Coleman.
Here.
Deputy Mayor Derrick Reid.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy Mcgee.
Here.
Tracy Hoos.
Here.
Item number 1.
Consider approval of Muskogee Municipal Authority minutes for regular session, June 8, 2020, special call session, June 15, 2020, and special call session, June 22, 2020.
We've all had an opportunity, I hope, to review the minutes. Do we have any revisions, or do we have a motion to approve?
Move for approval.
Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy Hoos.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. Item number 2.
Consider approval of MMA claims for the month ending June 30, 2020.
We have the claims before us on tonight. Do we have any questions or considerations for them? I've asked Mr. Miller to give us a statement on what those retained for capital projects are, and so that in future meetings we'll have a breakdown explanation of what those are as well.
Absolutely. So you see basically the 3 lines there. We have the reimburse to city for expenditures, which is our transfer to our general fund. And then we have the bottom one is for water and sewer obligations. So these are debt service obligations that we've made in the past for capital improvements. The one in the middle is what you asked me about, was retaining for capital projects. That is a budget that you guys approved. You asked us several years ago as a city council to take any increases in the water and sewer rates and apply those to capital improvements over the years instead of using it to increase that top line, which is kind of our transfer to the general fund, because we're so far behind on our water and sewer infrastructure. And so what this shows is the amount that is set aside for those projects, and you guys budgeted in the MMA. When we went through our budget presentation this year, I showed you that we had money set aside for capital projects through MMA. That's what this amount is, and it goes into. We budgeted, I believe, $2.1 million this year to take care of things in MMA. One of the things that we added this year, and again, I'll give you more detail in the coming months, was emergency repair contracts for both water and sewer. So in the past, if we had a water leak and we could address, or a sewer issue that we could address in-house, we had that capability, but sometimes they're large scale or take more time than we can devote, and we want to hire a contractor. This allows us to have funding in place to get that done quickly rather than try and do that on a one-off basis. So that's an example, and I'll be happy to give you in future months examples of what this money is used for.
Thank you, Mr. Miller. Do we have any questions, or are we ready for a motion?
Move for approval. Second.
It's been moved in second. Any further discussion? Roll call.
Tracy Hoos.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes. Mayor
Mayor Marlin Coleman.
Yes, and the item carries. That will adjourn the MMA meeting. At this time, we will call to order the meeting of the Muskogee City Council for July 13, 2020. Roll call. Afterwards.
Mayor Marlin Coleman.
Here.
Deputy Mayor Derrick Reid.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy Mcgee.
Here.
Tracy Hoos.
Here.
We want to take this opportunity before we go into our regular agenda to recognize the Employee of the Month, who is Ms. Marsha Wiseman. She's the Executive Assistant to the City Manager. She is not here on tonight. She had to leave, but we want to give her tribute. After a 35-year career with the AT&T, followed by a 1-year vacation, Marsha started her second career with the city over 5 years ago. Working for the city opened my eyes, she says, to how little I knew about how my city operates. My boss and the people I work with make me feel engaged. That my opinion matters, and that we work together, and what we do is important. When I look at what we accomplish, it makes me proud, says Marsha Wiseman. Off the job, Marsha is interested in politics, socializes with friends, and enjoys summer weekends at Lake Tenkiller. When we see Marsha, we will present her with her official certificate, but why don't you join me in giving her a hand for being recognized as Employee of the Month. We'll now proceed into our regular order of business. I'm going to ask that Deputy Mayor Derrick Reid will give us the invocation, followed by the flag salute.
Shall we pray? Dear Lord, we come once again thanking you for the gift of another day. Just thanking you and praising you for allowing us to come together one more time to be about your business here in our community. Just ask that you would look upon our community tonight as we are facing the COVID disease. Ask that you would just have mercy on us. Bless us and keep us, those who are affected, those who are sick from this disease, Lord, that you would just give them healing in the name of Jesus. These and many of the blessings we ask in Jesus' name. Amen.
Amen. Attention. Salute. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We've already had the roll call. We need to approve our minutes. Do we have any comments or discussion, or are we ready for a motion?
Move for approval.
Second.
We have a motion and an approval. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. The consent agenda consists of items 1 through 7. Do we have any items that need to be moved to the regular agenda, or will we approve the consent agenda?
Move for approval.
Second.
It's been moved in second. Do we have any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes, the item passes. Item number 8.
Receive report on the COVID-19 pandemic in Muskogee, and if necessary, take appropriate action to authorize and approve a subsequent amendment to Resolution Number 2801, declaring a local emergency, or City-County Joint Resolution Number 2803.
Mr. Miller.
Thank you, Mayor. We have, as you know, from watching the news, the COVID-19 disease certainly hasn't gone away and is strong throughout the country in various parts of Oklahoma. And so we want to make sure that we're addressing it in our community. I know the City-County Task Force has a meeting later this week to look at what's going on and to take other action and make recommendations if they so choose. I've asked Tyler Evans to prepare and discuss the situation as it relates to the city of Muskogee in particular and Muskogee County in general, as well as having some other people on standby to give us their expertise as well.
Mr. Miller, Mr. Mayor, members of council. There's been 200 cumulative total cases of COVID-19 in Muskogee County and 14 deaths so far. As I've stated in previous council meetings, I don't really like coming here and telling the total number because that number will never ever go down. It's a cumulative number. So we're counting cases from the very first case that we've had back in March all the way through. Even though those numbers have recovered, those numbers will never go down. So I've decided to take some data that we have and kind of tabulate it and break it down by population, compare Muskogee County to how the rest of the state is doing. And so that's what you have in front of you right now, and I'm going to walk us through that. As of Friday, 49 of those positive cases and 5 of those deaths have been on our long-term care facilities, such as our nursing homes and our assisted living facilities here in Muskogee County. There are currently 74 active cases in Muskogee County and 55 active cases in the city. There are currently 20,745 positive cases of COVID-19 and 424 deaths in the state of Oklahoma. As of Friday, 215 of the 424 deaths have occurred in the long-term care facilities. The remaining 209 people have died outside of the long-term care facilities. 78.6% of the deceased cases had at least one comorbidity, such as diabetes, heart disease, circulatory disease, lung disease, liver disease, renal failure. 80% of all the deaths are composed of individuals 65 years of age or older. Almost 96% of all deaths are composed of individuals age 50 or older. And this also takes into account the comorbidities that I just described, because they do not break that down by age group. I'm unable to take that data out of that. The survival rate of all younger than age 50 is 99.87%. For the age group of 0 through 17, there's been 1,900 cases, which accounts for a little over 9% of the total cases. 90.85% of the positive cases are individual older than 17 years of age. So below that, we start breaking down the data and tabulating a little bit. On the left-hand column is the population of Oklahoma, and the data on the left will reflect for the state of Oklahoma. The data on the right will reflect for Muskogee County. If you turn your sheet over, there's some other data that I'd really like to talk about. The data on the first page is really kind of what I just talked about in the beginning. The total mortality rate of diagnosed cases for the state of Oklahoma is 2.04%. For Muskogee County, it's 7%. The survival rate of diagnosed cases is 97.96% for the state of Oklahoma and 93% for Muskogee County. And so I broke it down. What we really didn't see is based on population. The total mortality rate of COVID-19 based on population for Muskogee County is 0.02% right now. So it would take your total deaths divided by the population, which was 69,997, and you times that by 100 to bring it back into percentage, and you come up with 0.02%. That leaves us with the survival rate of COVID-19 from Muskogee County at 99.98%. That is as of today, right now, as I'm speaking. The total percent of cumulative diagnosed COVID-19 spread by population, so this is going all the way back from when this started back in March, is 0.285%, which leaves us to the total percent of population that has not had a diagnosed case of COVID-19 at 99.715% for Muskogee County. The total percent of active COVID-19 in the population, you take your total cases, you take your number of recoveries out of that, you take your number of deaths out of that, that leaves you with the total active cases. Divide that by your population, you have 0.104% currently has active COVID-19 in Muskogee County, which means 99.896 does not have COVID-19 that we know of. The mortality rate of those not in a long-term care facility is 4.5%. As you remember earlier, I said the mortality rate for Muskogee County is 7%. If you take the long-term care facilities out of that equation, it comes to 4.5%. And the survival rate of those not in long-term care facilities is at 95.5% for Muskogee County, 99% for the state of Oklahoma. So this is something I plan to continue to update on a daily basis. These are the same numbers. You can go to the coronavirus website, coronavirus.health.ok.gov, and pull these same numbers and plug them in if you'd like to do that. The executive order reports is something that's published daily. Because the last report was Friday, I was hoping they would do today's report before this meeting, but they just hasn't updated it yet. The executive order reports also give some handy information as far as percentages, ages, so on and so forth. But at this time, I'd like to introduce Doug Walton from the Muskogee County Health Department to also talk about some data that the health department has and talk about testing. Mr.
Hey,
Walton?
Tyler, I'm not sure if you can hear me. I think I'm unmuted at this point.
Yes, sir.
Great. Okay. Thank you. Thanks, Mayor, council members as well. Won't try and give too many additional numbers. Tyler covered a lot of the data really well. Just maybe a little bit more on the sort of the regional scope. We've been kind of tracking the additional cases. And like Tyler said, you know, the total numbers are to date, but looking back over the last week in Muskogee County, we've had 57 additional cases with 3 additional fatalities since Monday of last week. A few other adjacent counties, Wagner County has had 62 additional cases in the last week, Cherokee County 31 additional cases, McIntosh 17, and Okmulgee County 57 additional cases. At the County Health Department, we continue to conduct testing daily, and to date we've collected over 1,100 samples for testing with 41 positive results. To date, we are still providing free testing, and as of today, until further notice, we are not requiring an appointment. So drive-through testing will be available daily from 8:30 a.m. until 11:30 a.m. We are asking people to come and arrive by 11 a.m. And the testing will be provided first come, first serve while supplies last. We do anticipate having enough testing supplies to be able to carry that out. And we are now also able to test ages 12 months and older. And again, these are free and don't require any symptoms to be eligible. We do also offer free rapid tests on site daily with the results available in about 15 minutes. The previous testing, it takes 3 to 5 days to get those results. They've been trending more like 2 to 3 days turnaround. But on the rapid tests, those do require that patients have at least one symptom and meet one other criteria to qualify. With our testing, we have been seeing an increase in the percent of positive cases or results from the testing that we are conducting. We did about 540 tests from the beginning in March up through the end of May, and only had 4 positive results from that testing. Since June the 1st, we've conducted approximately another 550 or so, and we've had roughly 37 additional positives. So we're looking at, a rate of about 6+% positive per the testing, whereas prior to the end of May, we were less than a 1% positive rate. So we are seeing that more people who are coming for testing are testing positive. We are still, and perhaps more firmly than ever, recommending that people wear face coverings whenever in public to protect each other and to maintain a distance of at least 6 feet from others when in public, to wash hands frequently before and after eating or touching our face, limit time away from home, especially if you are over 65 or have any underlying health conditions, and to stay at home if you are sick, and call 911 if you need immediate medical attention. And I think that's all I've got, Tyler.
Thank you, Mr. Walton. At this time, we have a representative from St. Francis, Muskogee, Mr. Kyle Coons. I'd like to introduce and give us an update in regards to St. Francis. Kyle?
Good evening, everyone. We have our emergency department and the rest of the hospital operating at close to normal capacity. We have seen a significant uptick in the number of positive and suspect persons under investigation, particularly over the last 2 weeks. We anticipate that those numbers will continue to climb. There are more positive patients in the hospital than we have seen previously in the pandemic. We continue, both here in Muskogee and throughout the system, to have bed capacity and staff and PPE to take care of the patients that are coming to us. One of the biggest challenges we continue to have, and it's not unique to Muskogee, but we continue to see patients and our families and loved ones that are waiting far too long to come to the emergency department, particularly with cardiac events, strokes. The patients that we are seeing are much sicker than we've seen in the past because there's still a level of fear in the community. I'm not sure how we address that we're going to need help from all of our community partners to try and allay the fears of everyone. We are working on several different plans to address the possibility of having to surge our inpatient and the emergency department capacity in the future. We don't expect to do that yet, but we will have places and robust plans in place. We've been working on that for quite a while now. You'll start to see some more work outside the emergency department in the next week or so that are part of that plan as well. Beyond that, I'll be happy to answer any questions.
Yeah, Mr. Mayor, we recognize.
Yes.
What's the gentleman's name?
Mr. Coons.
Mr. Coons, this is Councilman Ivory Van. How are you tonight?
I'm doing well. How are you, Councilman?
I'm doing all right. Have y'all, I know one time y'all was up here, it's been months ago, and I asked you a question about having all your employees out there wearing masks. Have y'all done that yet, or are you still not letting those employees, not mandatory them to wear a mask?
We require anyone in the building to wear a mask, and everyone that's in one of our buildings must be screened, their temperatures checked. We check for signs and symptoms, and then everyone is required to wear a mask door to door.
That's great, sir. It's good. That's good news to hear. If you don't mind, I got one quick question from Mr. Walton. Mr. Walton, you still there?
Yes, sir, I am.
You know, I was out there talking to you today. I'm just curious. I'm gonna ask this question again. On the nursing homes, have you went back since you tested them before? Have you went back? You've tested all the nursing homes, correct? One time?
That is correct.
Have you went back and tested any more?
No, sir, just the one time of all staff and residents.
Okay, because you know that one I was telling you about, Genesis, that came here last month out of Bigsby that we talked about today, they'd be more than happy to come back to Muskogee and go test these nursing homes free of charge. I mean, you know, the nursing homes patients, they have insurance, you know, I'm pretty sure, but they'd be more than happy to come back here and do that. And I know you said you were going to take it to your higher administration. And I know today you told me that, you know, nobody's ever got back with you. But I can't understand somebody not getting back with you, that you got a mobile unit that can go around every nursing home here in Muskogee, not in one day, but, you know, in days, you know, to help us here. Look like they would be willing to jump on the boat and say, yeah, we need to get them back here and check these people in the nursing homes.
Well, sir, I agree. It does seem like a good idea, and I think I intended to kind of indicate that I don't know that I expected necessarily to hear back directly myself. I did share the information with the people who would be making the decision about it.
Okay, so, I mean, who do they contact? Do you know?
Well, they received the information about the firm that's providing the testing.
Okay. Because like I say, I talked to Rebecca today, and they'd be more than happy to come to Muskogee and do that for us. And also, one more question, sir. On these tests that we're taking, are they the swab or the blood, or both?
The testing at the health department is all the nasal pharyngeal swab that goes through the nose, through the nasal passage.
Okay. So I don't know if we have authority as a city council, Mr. Miller, to get a hold of Genesis that I'm talking about. I'm going to let you give you the numbers after this meeting so you can give them a call. Mm-hmm. And like I say, this lady named Rebecca I talked to, she said she'd be more than happy to come to Muskogee as long as someone called and they're out of Bigsby. And they got a nice mobile machine. You remember when they was over the Civic Center? I don't know if you remember that or not, but I got my antibiotic blood tested and it come back negative. So, but they'd be more than happy to come to Muskogee and give us a hand.
All right. We'll be happy to follow up. Thank you.
I'll turn the floor back over to you, Mr. Mayor.
Thank you.
Mr. Mayor, might be recognized, please.
Yes.
Mr. Kuntz with St. Francis. This is Dr. Hoos. There was a report on 7/8 of 2020 that we were down to 2 ICU beds at the Muskogee facility. Is that still the case?
That's not the case as we speak, no, sir.
Okay, so
the number of open ICU beds fluctuates hour by hour.
well, are we still lower than 10% capacity on the ICU beds?
right this moment.
Okay.
So we have 24 ICU beds. In the past 7 days, we've had 23 beds full. We've had 13 beds full and bounced in between. We've had as many as 3 COVID patients in the ICU during that time. The bulk of the patients are not associated with COVID.
Okay,
That will continue to be the case.
thank you. That was my next question, if it was primarily COVID or other
It's
other issues.
Yes, sir.
Okay, thank you. Also want to interject on doing the serum testing, especially if we bring in some of that testing has very poor accuracy. I know with Genesis and Bigsby and everything, we just need to make sure that we do our due diligence if we bring anyone into this city, especially from out, that we're outsourcing, that it's the right test for, that we need to run.
Very good.
I'll turn the floor back over.
Thank you.
Mr. Mayor, if you don't mind, I have one more speaker I'd like to introduce.
Yes.
Trish German with Muskogee County EMS.
Good evening, Council. Today I'm just going to talk about our numbers. There's a few other issues. As of January 1st, 2019 to July 13th, 2019, we were hitting at over 12,000 calls on our call volume. From January 1st, 2020 to July 13th, 2020, we're just a little over 11,000 calls. So we are still down 1,100 calls from last year, with April and May being significantly low, about 400 calls a month, decreased from last year. I'd also like to talk about the increase in acuity level, just what Mr. Coons had talked about from St. Francis. We're noticing that our patients that we are transporting, they're waiting way too long. We've got to get some information out there to them saying, hey, call 911, come to the hospital, get checked out, because we're seeing patients with chest pain, stroke, cardiac arrest that just aren't making it, and they need to come to the hospital. On the transports that we are getting, we are noticing an increase in COVID-19 patients that are positive, but they're not going to the hospital because of the COVID. They're going to the hospital because of a higher acuity medical problem, the stroke, the chest pain, the difficulty breathing. So again, we've got to get some information out there to the public saying, hey, you need to come to the hospital. It is safe to go to the hospital. Don't wait too long. Muskogee County EMS has also reduced their PPE policy. From now on, you'll see our medics wearing surgical masks. They'll be putting surgical masks on all patients. A lot of this has to do with the fact of the medics are fatigued, the heat, wearing that N95 mask is a lot on them out there in the heat. However, they are wearing the N95 masks if they're giving a patient any kind of breathing treatment, they're intubating the patients, anything respiratory. The medics are wearing the N95 masks, and we're continuing to fog and disinfect like we're supposed to. So everything's being disinfected, everything's being done like we're supposed to still do in between each patient. In the event of the call volume, like Mr. Coons had mentioned, if by some chance Muskogee County gets overrun by calls, increase in call volume, the hospital gets overran, Muskogee County EMS gets, overran with calls, we have that option to call out a strike team, which means other ambulances from other regions will come here and help us with our call volume and with our transports. However, if other regions see a surge in the call volume, they have the right to ask us to come and help them. We will only leave and we will only go assist if St. Francis Hospital agrees and our emergency management gives approval for those. Does anybody have any questions?
Ms. Trish, I have a question. In terms of the education piece, that might be helpful to residents to understand their need to be able to call and get assistance instead of having a delayed response like they're doing. Is there a way that your office or your staff can coordinate what that education may be, and possibly coordinate with the city so that we can have that as an insert in people's water bills. Because my concern is that their delay, if it runs into a situation where we have an outbreak, is going to cause us to be overrun unnecessarily and not be able to treat people who need to be treated. So I think that education piece is correct, and I agree with you. I'm just wondering if there's a way that we can coordinate that with the city so that we can make that an insert in people's water bills, since everyone in the city limits that we know of gets a water bill.
Definitely. A few months ago, Doug with the health department, he put out a report, a press release for social media, and we did get that out. We were talking about putting out another one. So maybe we can get with Doug again for the correct verbiage on exactly what we need to put in that insert, and definitely we can help, emergency management can help, and definitely get St. Francis on board.
I think it'll be good because we do know that every resident gets a water bill. We don't know that they're all on social media.
Okay, definitely. Any
Thank
other
you.
questions? Thank you.
Mr. Mayor, if nobody has any questions for me or any of the speakers, I'd like to turn the floor back over to Mr. Miller.
The only question I have, Mr. Evans, is
Sir.
the information that you presented, is it possible to construct that into a graph that's like an easy to understand visual? Because
Sure.
most residents will understand an image in terms of a graph better than they'll understand the actual data that's been presented.
Yeah, absolutely. Any of these percentages would be easy to turn into a bar chart or pie or anything like that for them to see. Like I said, we already took the data, which was maybe not the most easiest to read, and converted those into percentages. But yeah, it wouldn't be no problem at all to convert that into graphics, and I agree with you.
Because I think if a resident sees a line going up or down, it'll help them to measure the severity of what we're dealing with.
Sure. And that is already done for the state of Oklahoma on the coronavirus website. They have a lot of good graphics and visual representations on that. But taking this data and modeling it for Muskogee County or even the city of Muskogee wouldn't be an issue.
Thank you.
Yes, sir.
Mr. Miller?
We do look forward to the task force meeting later this week, and if there's recommendations forthcoming, we'll be able to address that next Monday at, if needed, a special call council meeting.
Mr. Mayor, may we recognize?
Yes.
I have a quick question for you, Mr. Miller.
Mhm.
You know, like here in Muskogee, Oklahoma, like I'll say twice a week, if you could keep the council informed of how many people have the virus, it'd be some good information for me. I know it would, if you don't mind doing that.
Should not be a problem.
Thank you, Mr. Miller. I turn the floor back over to you, Mr. Mayor.
Thank you. Any other further discussion on item number 8?
Mr. Mayor, can I be recognized?
Yes.
Mr. Miller, did you get the information on the mitigation? Were you going to share that?
I'm sorry, I did not get a whole bunch of information. My apologies. I know you asked me, and then we had our pre-qualification meeting, and I did not get to it. I will, at the risk of, number one, we can definitely talk about it next Monday. But I'll just inform Ms. Callahan, I've not previously been able to do that. But Councilor Mcgee did ask me if there were, what measures we had taken to make sure people were following their mitigation plans. And I know that we've done several audits for a few weeks. You may want to speak extemporaneously, or you may want to wait until next week and when you have more data at hand. But I want to inform you that that's the general question.
Okay. I'll get it prepared.
Okay. Thank you.
Thank you.
Thank you. Item number 9.
Hold a public hearing and take action on the approval of ordinance 4095A to rezone Lot 1 in Block A of Melrose Place replat, City of Muskogee, from C1 Local Commercial to C2 General Commercial, and if approved, authorize staff to revise the official zoning map of the city to reflect said change or take other necessary action.
We will now open the public hearing. Ms. Callahan.
Thank you, Mayor, Council. This is a request from the JKJ Corner Stores. It's Nouvelle Corporation that is the applicant. They are requesting to rezone from the C1 to the C2. This is the former Taco Mayo building that's next to the McDonald's, if you'll remember. It does have a drive-through, and because of the legal nonconforming use or vacancy, they are now would not be allowed to have a drive-through according to our city ordinances currently. So they are rezoning so that they can come under compliance, and it will be a better sales option, or be able to lease it or sell it better, having the correct zoning for the property. It was recommended for approval by Planning Commission and Public Works, and be happy to answer any questions.
We don't have anyone that has signed up to speak to this item. However, Ms. Callahan, the question I do have is that going forward, can we go back to our graphics so that when
Yes.
you make that presentation, the
Yes.
residents can actually see that area?
Yes.
Thank you. We will now close the public hearing. Do we have any other comments from the council?
Move for approval. Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. Item passes. Item number 10.
Hold a public hearing and take action on the approval of Ordinance 4096A to rezone lots 1 through 5 in Block 388, Muskogee Original Town Site, to the City of Muskogee from C1 Local Commercial to C2 General Commercial, and if approved, authorize staff to revise the official zoning map of the city to reflect said change or take other necessary action.
We'll now open the public hearing. Ms. Callahan.
Yes, thank you, Mayor Council. This is a request from Yummy Chicken LLC. Amar Nawaz owns the company. It is the Church's Chicken site and the property that is to the west of the current Church's Chicken. They are building a new Church's Chicken. It will have a drive-through, and so requires the C2 zoning classification. In discussion with Mr. Nawaz, we decided, I recommended that he go ahead and rezone all of his property. He will plan to remove the current Church's Chicken facility and is hoping to build some more commercial property through there. So I really appreciate him wanting to work with Muskogee and add to the commercial construction down through that corridor. So staff recommends approval, Planning Commission and Public Works recommended approval.
We don't have anyone who has signed up to speak to this item. We will now close the public hearing and take any questions or comments from the council.
Move for approval.
Second.
It's been properly moved in second. Any further discussions? Roll call.
Tracy Hous.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. The item passes. Ms. Callahan has asked that item number 11 be tabled.
Yes, this item will be tabled to the July 27th City Council, but it will be heard July 20th at Planning Commission and Public Works after the land use amendment is heard, and if that is approved, then we can hear the rezoning. Notices are going back out to the surrounding property owners to let them know of the meetings on the 20th and the 27th.
Thank you. Item number 12.
Hold a public hearing and take action on the approval of Ordinance 4098A to rezone lots 7 through 9, Block 331, Muskogee Original Town Site, to the City of Muskogee from R1 Single Family Residential to I1 Light Industrial, and if approved, authorize staff to revise the official zoning map of the city to reflect said change or take other necessary action.
We will now open the public hearing. Ms. Callahan.
Thank you, Mayor Council. This is a request from Brandon Davison. He's currently the applicant. The owners are still the Ryder truck repair business. They are selling it to Mr. Davison, and while it still conforms, legal non-conforming, he could have moved right in and continued operating as the truck diesel. They chose to get it zoned correctly so that in the future it would meet the ordinance requirements and he would have it all under clear title. So it does meet the future land use map, and Planning Commission, Public Works, and staff recommends approval. Happy to answer any questions.
We do not have anyone signed up to speak to this item. We will now close the public hearing and take comments or direction from the council.
Move for approval. Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. The item passes. Item number 13.
Consider approval of ordinance number 4100A and joinder agreement amending the employee retirement system defined benefit COLA plan for retirees only for the city of Muskogee, Oklahoma, to incorporate IRS changes, state law changes, and/or clarification and cleanup language, providing for effective date, providing for repealer and severability, and declaring an emergency, or take other necessary action.
Ms. Plunkett.
Mr. Mayor, members of the council, this ordinance and joinder agreement is for our retirement plan. It is for only one participant. It is the defined benefit plan. All other employees contribute to our defined contribution plan. This lady that is on this plan was hired in 1951. She retired in 1976. Again, she's the sole participant on this plan. These changes are they occur every 6 years. We have to approve these changes in order for our plan to be in compliance with the IRS. Happy to answer any questions. This does need to be set for an emergency, as it does need to be approved by July 31st of this year.
Thank you, Ms. Plunkett. Do we have any questions or discussion from the council?
Yeah, Mr. Mayor. This is item 14, not 13. We've been on the wrong numbers.
You should have an amended agenda. There was one taken off of the consent agenda Friday when it went out, or I'm sorry, Thursday.
I'm gonna send you that one.
It's 14 on one and 13 on the backup documentation.
We had already done the packet, so we just redid the agenda.
Okay. I'm wrong, I guess. I'm just looking at what I got on my packet.
Right. What is the pleasure of the council on item number 13?
Move for approval.
Second. It's been moved in second. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes, the item passes. I'll now entertain a motion to declare an emergency.
Move for approval.
Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid. Mayor Marlin Coleman.
Yes, the item passes. Item number 14, I believe Councilor Reid has asked that it be withdrawn.
Yes, please.
We will withdraw item number 14 at this time. Item number 15.
Consider approval of a second amendment to lease agreement of July 1, 2010 between the City of Muskogee and Three Rivers Museum of Muskogee, Oklahoma, or take other necessary action.
Mr. Tucker.
Thank you, Mayor, members of the council. We entered into an agreement several years ago for the building that comprises the Three Rivers Museum, as well as certain land that surrounds it. That agreement is set to expire was set to expire on June 30th, 2020. We did prepare an amendment which extended the lease for another 10 years. The board of the Three Rivers Museum has approved that amendment, and so it brings it before you today. And so if approved, that lease on the building and the land surrounding it, not all of it, just certain tracts of it, will be effective until June 30th, 2030. With that, I'm happy to answer any questions.
Do we have any questions for Mr. Tucker? Or we will entertain a motion.
Move for approval. Second.
It's been properly moved in second. Roll call.
Tracy Hous.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes, the item passes. Item number 16.
Discuss and take action to require independent inspection services be included for all public street projects competitively bid by the City of Muskogee.
This is my item. I have had a conversation with Mr. Miller, and he has had a conversation with his staffs. We want to be certain that as we move forward to reconstruct and redo and repair all of our streets going forward, particularly mindful of the bonds that have been passed, those CIPs, with regard to upgrading our streets, that we have inspection services on all of those locations so that we do not run into some of the impediments or difficulties that we've run into in previous contracts. And so my motion will be to the council that we require independent inspection services be included for all of our public street projects competitively bid by the city moving forward. And I'll take any questions or a second to that motion.
Mr. Mayor, may we recognize?
Yes.
I remember back in October of last year when we started on 24th Street, and at that time, Great Plains was going to do all the inspections on 24th, and then they were going to come to our ward. But also was promised that instead of, I told Great Plains, which what's her name? It's over the street on 24th, Mr. Miller.
Jessica?
Jessica?
Mm-hmm.
I told Great Plains that the engineer to teach Jessica all you can teach her. Y'all remember that, correct? Mm-hmm. And that's what I thought they were doing. Also, I was told that we would, instead of hiring somebody off, from somewhere else to keep our money here, they promised me up here that we were going to get somebody and hire them to do the job what Great Plains is doing. So this is telling me right here that that promise is not being kept. And we must have went to sleep or forgot about it or something, because I remember just like it was yesterday. So one thing about videos, you go back and look at them, you can see what went on. And so I have a problem with that, because we need Great Plains. Don't get me wrong, they was up here last week. They do an absolutely great job. But what our problem is, we don't have staff in-house that we need to do the job. You take Mr. Stewart, for example. He had to come back out of retirement to do public works, which that don't make sense. We need people on our staff that's already trained and ready to go. I know we lost a lot of staff, but still, you should be getting things ready. You just don't wait till the last minute. That's what I'm talking about. I mean, we need people here that's going to do it from now on, and we can pay them and keep our money here in Muskogee, just like I argued about it then. Mm-hmm. But like I say, somebody misinformed me at that meeting in October. Because like I say, you can go back and look at the videos. I'm pretty sure. Am I correct, Mr. Miller? Because I remember you said.
Well, Councilor Van, I don't think I've done anything different than what I've told you. And I don't think I've done anything different than what we've talked about as a group. I think what is being proposed by the mayor, and perhaps without me going out too far on a limb, I think what we really want is inspection services in my book, and the mayor's proposed that they always be independent. I don't know if there may be some projects that we can do in-house better than we can do or as well. So I don't know if that's what you're referring to. We do have positions that are open in the recently passed budget. As you recall, we just now have the budget for this fiscal year, and we're developing job descriptions to improve our in-house inspection capability. We haven't hired those people yet because we're not yet 2 weeks into the fiscal year with the budget to do that. But that was one of the things that we discussed, was improving our in-house inspection capability. And I've talked to Mr. Stewart, and he's working on developing a job description that will help fit that bill. I don't want you to think that anything I've told you, that I'm not doing anything that I've told you. I want you to understand I'm doing everything that I told you I was going to do.
Okay.
I don't know that this is in conflict with any of that.
Well, I was just, trying to get the money to stay here in Muskogee like they promised. We were going to do this time because it's Great Plains, like I said, we was in a bind then, but I don't think we're in a bind. I mean, I'm glad you're getting something in place. But we are getting someone in place to take care of our streets, because, like I say, to be a street inspector, it takes some qualifications. Just like 24th Street, I'm glad we brought the inspector in, because you know how much problems we've had on 24th Street. You know that. And I was the only one voted no up here not to get that contractor we got now, but we got him. Y'all remember that too, correct? But I'm just making sure, because I have a good memory. And when somebody tell me something, I take a person at their word. Like I say all the time, you show me once about yourself, I'll believe you.
So.
What is the price going to be on this independent inspector's process?
Well, what I would anticipate, again, this is for discussion today, and we've not developed a program or a plan. This has been put on the agenda for discussion today. What I would anticipate happening if something like this were put in place is that when those bids come forward, when we bring you forward the package to approve a project, again, everything over $25,000 you guys approve. So it'll come forward to you and it'll say, here's the projects, here's what the streets that are going to be paved or resurfaced, here's the inspector fee, or we'll have either on that agenda item or a companion agenda item, depending on how we award those inspection services, and that will be determined at that time.
And Councilor Van and Councilor Reid, I'm certain that once the city does get to the point where we do have those inspection services in-house, that then those will be the inspectors assigned to those projects. But in the interim time, while we do have the new bids that are getting ready to come in, as well as some of the other projects that we want to go on forward with, I just think it's prudent to, at this time, at least say that we'll have some type of inspection services in place so that we don't have some of those problems like we've had in those other projects.
I just want to make certain I kind of reflect back on what Ivory is making reference to. So it's been October until now, and we were supposed to have, this person in-house in place. And so I don't want to see us drop the ball and have to go back each and every time because, once again, what we stated back in October is that our streets are in a condition to where we are always going to have street repair, and we needed to create that. And so, since October to now, for us to have to come back and put on this agenda item, it looks like that ball has been dropped. But if the process is moving forward, that's what we want to see. But I'm, still reluctant in going contract by contract and bringing in an independent, inspection service when we should have, as directed back in October, had this piece in place.
I have a question. Is this in addition to the inspector that we approved back toward the end of last year?
So we have an inspector on 24th Street. That inspector is also working on some of our other water and sewer projects as well. And so I won't speak for Mayor Coleman about what he anticipates happening with this independent inspector, but the way this reads, it would be, as we bid a new job, we would hire an inspector to do that new job.
And Councilor Reynolds, to answer that question, we had not had an inspector originally assigned to 24th Street. We borrowed the inspector or are sharing the inspector from the water line. What I'm attempting to do is be certain that whether we have a shared agreement or otherwise, that somebody is inspecting that project, whether it's in-house, whether it's through an agreement that we have like we have now with 24th Street, or at worst case scenario, we have to go out and get one. But at all times, what this agenda item does is guarantee that somebody is inspecting these projects, which I think at least to those voters who approved that CIP, we owe them to be certain that we're doing that, because in previous times, it should not have been one of us going around. Councilor Van has done it several times. I've done it several times. We go around and we're doing what an inspection service or an inspector on the ground should actually be doing. And what this agenda item does is make certain that as we move forward with these projects, somebody is doing that. And right now, we don't have a formalized plan to say that that'll happen, other than hoping that if we have an inspector on the ground, we can either share that person or trust that someone will do it without it being formalized. And I think at this point, with the amount of money we're getting ready to spend on streets, we need to be certain that somebody is actually doing that.
Well, one of my first meetings, if not the first meeting, we approved somewhere in the neighborhood of $140,000 for a road inspector to come in and inspect these roads. Is this in addition? Are we talking about someone in addition to that?
Addition.
It's
or
cool.
Is that contract expiring already?
It's quite possible that that inspector would be willing to take on additional work since they're already here at some kind of reduced rate, but we couldn't tell you that for sure. I would say that The next bid package that we probably have going out for streets is in the neighborhood of $6 million. And so that's a lot of street repair to be inspected. It's something that we should be, the council should be applauded for, that we've got that in place to spend that kind of money on streets, really unprecedented amount of money. And so if we devote a small percentage of it to an inspector to make sure that happens, I don't have a problem with it. One of the discussions that we had previously is when we had a $4 million 24th Street project, that we felt like that we needed to have an inspector on that. And when we do smaller projects, we're sometimes able to do those in-house. And that was the discussion that we had last October. And I do just want to re-emphasize and give city staff some credit that the reason we don't have an inspector now is that the budget to hire that inspector and that position is 2 weeks old. Since October, we took that direction, but the budget was approved by council and went into effect, July 1st. And so we are taking action quickly on that direction now that there's funding available to do so.
Well, I commend you, Councilman Coleman. I mean, because when this project first begun, it begun in Ward 4. I remember just like it was yesterday. And we needed an inspector then, but we didn't have an inspector in Ward 4. That's why down on Tamaroy, you got chip and seal and gravel on those people's driveway, because I had to go down there myself, people calling me. And then when we came to 24th Street, we got, out there on 43rd, when we got to Great Plains. And then they went to 24th Street, and then I asked, if you correct me if I'm wrong, Councilman Reid, I asked them to go in our ward and inspect it too to make sure our streets were getting done right. And over in our ward, they wasn't getting done right. Covering up drains, you can go over on 20, you can go over on 30th Street and come out of Runts Barbecue. Look at that mess right there they left. So I applaud you because we definitely need street inspectors. But what I'm saying is, don't drop the ball on me when you're going to tell me that we're going to have some people on staff to do this for our city, which we need desperately. We definitely need that desperately. So I feel that this ball was dropped in October up to now, because we shouldn't have to be asking for another, inspector. We should have one already ready to go. Jessica, she's been around the inspections for quite a while now, since this project. They were supposed to be training her and guiding her, because like I say, Mr. Stewart, he's good and he knows about streets, but he's the public works director. He ain't got time to stay on the job all day. He's got his own job to do. So that's what I'm saying. I mean, if we're going to do something, let's just don't say we're going to do something one week and forget about it the next like we ain't said nothing. Other than that, hey, I ain't trying to start no trouble or anything like that. I just want you to tell me something. Mm-hmm. Tell me something and stick to it.
And that's why we made sure I didn't forget it, and that's why I made sure we put it in the budget, and that's why when we went through our budget presentation, I singled that out, that we're going to have more inspections, because I did listen and I did follow through.
So when do we plan on hiring this other person to
We're doing the job description now, and we'll begin our hiring process.
Okay, well, that's good to hear. Okay. I'll turn the floor back over to you, Mr. Mayor.
Thank you. And let me say to the rest of my colleagues, tonight we're not talking about costs, we're talking about procedures, to be certain that we do have someone in place that is always going to do inspections. And as Mr. Miller has said, I would assume that if there is a cost that is above the threshold that we normally set for that to be approved in-house, that is going to come before the council, and so we would vote on that anyway.
Because I like these new councilmen to know the things that happened back, that y'all wasn't up here then. Mm-hmm. And y'all need to get up to speed on this stuff too. And like I say, it's just, hey, just trying to do what's right for our city the whole time. I mean, I just want things, we pay these people all this money, but we need just quality work. That's all I say when I'm up here. You know that, all the time I say that. We need professional quality work, craftsmanship work. So I'm turning the floor, I ain't gonna say no more.
I just want to add, I'm really uncomfortable with the process, that's before us, not to the point where I don't trust that this is not a needed item. I know it's a needed item. It was needed back then. I just don't want us to 2 and 3, 4 and 5 months from now not get to the point where we're trying to create this somebody that we have and, on our staff as directed, to that should have been done back in October.
But this doesn't prevent staff from actually being the inspector.
I just want to make sure, that this process don't push that to the side, because I kind of feel like it was pushed to the side back in October up until now. I'm understand we need this inspector, and that's not what, the debate is that I'm presenting. I just want to make sure that we get there.
Yeah, and we can take this, if I'm not incorrect, Mr. Tucker's direction to staff, that as we move forward with all of our projects, we have an inspector on the ground, whether it's in-house or otherwise, come before the council for approval.
That's correct, Mayor. The only challenge with that, with the actual language of the agenda item, is the requirement for independent inspection services. With that in there, it will create some level of confusion for staff, whether independent means a different department or within the city or somebody outside. So I would request that if that's the recommendation of the council, that just simply be removed, and then it would say require inspection services to be included on all.
Yes.
Can we simplify that through a motion, or do we have to represent the item?
No. I mean, you can, if it is your desire, then the motion would be to require inspection services be made for all public street projects, but competitively bid, regardless of whether they are in-house or
external,
included in the project as a whole.
Can we also specify qualified?
I'm sorry.
Can we specify qualified?
Absolutely. My only question to that would be, do you all want to make any certain requirements as to what those qualifications are?
I would think so. At least you got to have some experience in streets, knowing what you're doing, because we have been at this road before with inspections, and we know that we have brought forth some independent inspectors on the inspectors that we have here at the city, so we want to be clear when we bring that forward.
If I may make a suggestion, Mayor, based upon Councilor Mcgee's comments and the way the agenda item is written, because this is effectively what would be a new council, or not a council policy, but a new council policy, but an amendment to an existing council policy, particularly our purchasing policy, it might be appropriate for staff to take as direction what has been discussed here, represent that as an amendment where we can flesh out some of the issues related to what qualifications there are, and to clarify that it's either independent or in-house, depending on budgeting and things like that. Is that something that may be agreeable to? This is your item, that's fine.
Yeah, I'm fine with that if that's the pleasure of the council.
Sounds good to me, Councilman Coleman.
And that way we'll have
Mayor
a
Coleman.
formalized package that we could all live with going forward.
Yeah, so we can take that as direction to prepare that for the next agenda, next council meeting. City Manager, I don't know that we have, and Mr. Stewart, you might be able to address this. Do we have any bid packets that are currently going out for street projects?
So we currently have one under review, could very well come before the next council. But at that time, we can make sure that we address what type of inspection services we're going to do for that.
Yeah, we're going to do inspection
particular project
services
to keep it from being held.
Absolutely.
And then continue to work toward the direction that the mayor's trying to give us.
And I wanted to bring that up, Mayor, because I didn't think that there was any intent on the council to delay any of these projects, but still recognize what the desire of the council was.
So we have that ready for the next Public Works agenda. That would be enough time to do what we need to do.
So that packet is under review. We're going to try to have it on the next agenda.
Okay.
But there's quite a bit to review still.
So we'll try to have, I'm assuming Mr. Tucker, that'll be okay, our agenda item formalized so that by the time we have this one, it can work hand in hand.
Yeah, I would caution that to have it ready for, say, the next Public Works agenda gives us about 1.5 working days to get it done, to get it on the agenda for next week. So if we just may have, we may beg patience depending on how long it takes to get that policy drafted to have it in time for Public Works Committee.
Otherwise, it could be, since this item has been discussed, direct to City Council.
Yes.
And so next week would be potentially the packet to be discussed and approved, and then ultimately be approved by the council a week later at the same time that this item comes on. so that there isn't a delay, that they're approved at the same time.
Yes.
And
They're
that's-
just
and that's
discussed.
given that that packet is ready to go and ready to be placed on.
Assuming that, yes.
I'm fine with that. Is council fine with that?
I'm fine with that.
All right. Item number 17.
Receive report from Parks Department on parks projects, including the status of remodeling the former Fire Station Number 3 and construction of the Hatbox Arena, and take other necessary action.
Councilor Stout.
Yes, we have lots of exciting things happening, and I've been asked on updates on them, so I just wanted to have the Parks Department come over and give us an update on the new on the fire station remodel for the seniors building, and as well as out of Hatbox.
Okay, be happy to do that, Mr. Mayor, Council. Today I'm going to do very brief update on 4 projects, the Hatbox Arena, Station 3, the Depot Green, and the MKT Trail. You see the one starting there. Actually, that is Station 3 that you're looking at there, so I'll jump to it. The existing structure was built in the late 30s, and in January 19, it was slated to be renovated as a community center in some fashion. Well, you can see it was tired, it was falling in, it was a terrible state, and something needed to be done if we were going to save this part of Muskogee's history. So construction started in October of 2019, and the Parks Department is the general contractor on the project. This was going to be a complete renovation. New roof, plumbing, HVAC, electric, walls, restrooms, windows, entries. An adjacent building was purchased, demolished, and a parking lot will be going in. The current budget for the project is $313,000, and it comes from CIP, Egan Trust, and the City of Muskogee Foundation with a city match. And we've had issues with production and manufacturing unavailability due to coronavirus issues, but the construction is continuing, and it's hoped will be complete by late summer or early fall. And Depot Green. The Depot Green project has been a long time in the making. The new facility on Elgin between Maine and 3rd Streets was designed by Planning Design Group, which is a landscape architecture firm out of Tulsa, who many of you may know and will be familiar with since they've done a number of design projects for the City of Muskogee. The project includes an extension of Centennial Trail from 3rd to Main, trailhead facilities, a green space, event lawn, shelter, sidewalks, lighting, historically significant landscaping, restrooms, and facilities to host food trucks for special events. The contract for this is $1,497,520.93 with Williams Contracting, and it was approved in November of 2019. And the project currently is 45% paid, with approximately 60% of the construction done and complete. And after some significant weather delays in the spring, we are on track to finish the project in late summer or early fall. The Hatbox Multipurpose Complex. In 2017, the Parks Department embarked on a project to renovate the existing large hangars at Hatbox Field to create a place to host events. And as with the fire station, we were our own general contractor for this project, which saved the citizens a very significant amount of money. As a result, we now have a very well-liked large space to hold events, but it's limited due to there being no climate control in these facilities. So under the direction of Mr. Wilkerson, we embarked on a project to create a large space with great amenities, climate control, and ease of access. And in 2018, proposals from 9 architecture firms were reviewed, and a contract was entered into with GH2 Architects in Tulsa. The original design had to be reduced in scope to meet budget restrictions, and the bid was finally let to Williams Contracting for $2,144,000. And tonight, there was a change order approved by the council to bring the total to $2,159,188. And the funding for this project comes from the City of Muskogee Foundation, with the change order tonight being funded by CIP funds. The project is currently 57% paid, and approximately 65% of the construction is complete. And the schedule is still on track to be finished by late summer. And lastly, the MKT or Katy Trail is 80% funded by a grant from the Oklahoma Department of Transportation, and the remainder is from 2014 CIP funds. The construction oversight is performed by ODOT, and once the design process was complete, we have had little to do with the construction. Usually we only hear from them when there's a problem that we need to help solve. And the Katy Trail is essentially an extension of Centennial Trail, which will now extend from downtown at Maine and Elgin, westward, circling Hatbox Field, and heading northeast toward Maine and Shawnee. With the new extension, it'll stop a short bit west of Harris Road and York Street at Mayor Lane. The first phase of this new trail extension is going to travel north from Centennial Trail and Chicago Street, and it will cross Shawnee. And from here, the trail turns eastward, eventually crossing Main Street, and heads to the railroad right-of-way as it crosses under Shawnee Bypass. And the utility easement upon which the trail is built traverses northeast and connects with Mayor Lane, which will be just south of Harris Road. May I answer any questions that you might have?
Thank you for taking your time this evening coming to give us an update. We appreciate it.
It is my pleasure.
What kind, excuse me, may I be recognized, Mr. Mayor?
Yes.
Which company on the Katy Trail here, what company done that? What construction company? I know it was for ODOT, correct? ODOT?
Yes, McClellan Contractors, yes.
No, that's the engineer.
That's the engineer, that's right.
It's Ross.
Roscoe.
Yes.
Yeah.
Ross Construction?
Yeah.
Mm-hmm.
He done a good job. I mean, he did. I mean, I can just see the difference in the work, in the craftsmanship of that work, and the time it took. Mm-hmm. Just like the Katy district, you know, that rock, that roof, mm-hmm. Quality. I mean, quality.
Mm-hmm. I agree.
That's quality, you know. Mm-hmm. And I commend the Parks Department and your staff. Mm-hmm. It look like they're doing a great job. I see a lot of them over there working. They do good work. I commend them.
Thank you.
If I commend them, you know they're doing some good work. Because sometimes I'm up here rah, but I commend them.
Thank you.
That's right. I'll turn the floor back over to Mr. Mayor.
Ms. Stout, do we have anything else?
We are good.
Thank you. Thank you. Item number 18.
Consider approval of the appointment of Counselor Stephanie Morgan to the Purchasing Committee to serve commensurate with her term, replacing Mayor Janie Boydston, or take other necessary action.
This is my recommendation. I've had an opportunity to visit with Ms. Morgan, and she's agreed to serve in the place on the Purchasing Committee, and I recommend approval.
Second.
It's been moved in second. Do we have any other discussion? Roll call.
Tracy Hoos.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Most definitely.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. The item passes. Item number 19.
Consider approval of the appointment of Counselor Evelyn Hibbs, excuse me, as Chair of the Public Works Committee to serve commensurate with her term or take other necessary action.
Again, this is another one of my recommendations. I have had the opportunity to visit with Ms. Hibbs and have worked with her on several committees and know that she's well capable of serving as the Public Works Committee Chair, and that is my motion for approval.
Second.
It's been moved and second. Do we have any discussion? Roll call.
Tracy Hoos.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Most definitely again.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes, and the item passes. That will conclude City Council meeting for tonight. We have one citizen wishing to speak, Mr. Stephen Ezel. We'll ask that you'll come up, give us your name and address, and you'll have 3 minutes.
Thank you. Stephen Ezel, 6121 South 6th Street East. I'm here this evening in my capacity as a state chaplain with the American Legion, and also soon to be installed as my squadron's commander here at the local American Legion post. So I'm here to let you guys know on September the 6th of this year, you know that's a Sunday, it's going to be in the afternoon, we are going to be having an open house at American Legion Post 15 at 4021 West Broadway. We will be celebrating our post's 100th anniversary. And here's a question. Do any of you know who Hine Dentistry is?
Mm-hmm. Yes.
Otto Louis Hunter Hine was our American Legion Post's very first commander. In fact, in 1921, when James F. Smith, for whom our post was named after, was brought home, he presented the burial flag to the Smith family. American Legion, basically our motto is for God and country, and we, since our very beginning, have done a lot of things to help with our community, namely to help veterans. We also instituted the first flag code. We gave a grant to the American Heart Association, which has helped them to do heart saver CPR training, all that good stuff. And we do a lot of things for young people, such as American Legion baseball, junior shooting competitions, oratorical competitions, and boys and girls state and nation, which actually teaches them about the process of how our American system of government works. I encourage all of you, if you are able, to come out to our open house or just to come out to our post on a meeting night. We meet the second Tuesday of each month, and we like to encourage people in the city departments who are veterans to become members, because we can actually assist them in obtaining veterans benefits if they've had, say, difficulties in the past. What else can I think of? Well, we are still having our 3rd annual Hot Dogs and Heroes picnic and cemetery restoration. What we're going to be doing this year is we're honoring the medical personnel in the COVID field. So I just thought I'd bring this all to your attention. And Mayor Coleman, I know that you want to meet with me sometime next week. Give me a call.
Thank you, Mr. Ezel. Item number 20.
Consider an executive session to discuss and take possible action on the following. A, pursuant to Section 307, C10, Title 25, Oklahoma statutes, consider convening an executive session for the purpose of conferring on matters pertaining to economic development within the northeast quadrant of the city, and if necessary, take appropriate action in open session.
Can we have a motion to go into executive session?
I'll make a motion to go into executive session.
Second.
Been properly moved in second. Roll call.
Tracy Hoos.
Yes.
Tracy Mcgee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes. The item passes. I'm going to ask that you all please excuse yourselves while we go into executive session at this time. We will now reconvene from executive session. Roll call.
Mayor Marlin Coleman.
Yeah, here.
Deputy Mayor Derrick Reid.
Here.
Ivory Van.
Here.
Jamie Stout.
Yes.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan. Here. Tracy Mcgee.
Here.
Tracy Hous.
Here.
Mr. Tucker.
Item 20A, pursuant to Section 307C10, Title 25 Oklahoma statutes, the council did convene an executive session for the purpose of conferring on matters pertaining to economic development. After being briefed on the status of a potential development project within our city, I believe an appropriate motion would be to approve a plan to entice a business to locate within the northeast quadrant of the city under the terms discussed in executive session.
We will entertain a motion to that effect.
Move for approval.
Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy Hous.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derrick Reid.
Yes.
Mayor Marlin Coleman.
Yes, and the item passes. Before we adjourn, I would encourage all of our residents to do what they can in light of COVID-19 to keep themselves safe. Do whatever you can to keep your family and your well-being protected at all times. Having said that, we are adjourned.